In 15 brief minutes, I've been asked to summarize for you the large and diverse field of pain psychology. If you conservatively dated the field of pain psychology to the first publication of what is known as gate control theory, the paradigm-changing theory of pain first proposed by Melzack and Wall in 1965, and that identified the important role of psychological factors in pain, then the field of pain psychology is now more than 50 years old. Entering pain psychology into the search field of the government website PubMed yields more than 50,000 articles on pain psychology topics, with thousands of those articles providing results from clinical trials and other treatment studies examining dozens to hundreds of different types of pain psychology treatments. Given the formidable task of summarizing pain psychology for you here in just a few minutes, I will necessarily take a few shortcuts by providing you with first a brief overview of pain psychology treatments, and secondly, some basic information about how these treatments have been helpful to many of my patients in the past, and perhaps many of your patients in the future. Let's begin with the big picture on pain psychology treatments. Here are the most frequently used pain psychology treatments active today. Two of these treatments, cognitive behavior therapy and acceptance and commitment therapy, are common psychotherapies used today for many different types of mental health conditions, and that have been adapted more specifically in recent years to pain management. The next two categories are behavioral therapies, often used to assist with pain management. Many people forget that psychology is the science of behavior. Psychology is not the science of thinking or even the science of the brain. Although mental processes are, of course, very important in psychology treatments and in psychology research more generally, behavioral change remains the gold standard for whether a person is improving, whether we are discussing the treatment of depression or the treatment of pain. Pain groups, finally, may include any of the other types of treatments listed here, but are specifically performed in a group context to take advantage of social dynamics. A quality pain group, for example, can provide greater motivation to patients and increase treatment adherence, offer opportunities for modeling behavioral changes and practicing new skills, and in general make the process of improving pain management skills more enjoyable. The second important question about pain psychology is what actually happens in a pain psychology treatment. Although specifics vary according to different types of pain psychology treatment, the most effective pain psychology treatments address one, several, or even all of the areas listed here. Promoting regular physical activity is important, for example, as chronic pain tends to promote inactivity and physical deconditioning. Pacing involves learning new ways to approach activities, such as taking breaks or breaking activities into pieces, and helps people to become more productive despite their pain. Pain often has harmful effects on relationships, including work, family, and friend relationships, and often benefits from helping patients and their families adjust to this new dynamic. Sleep, fourthly, is usually one of the first casualties of pain and can set off a cascade of negative effects if poor sleep is not addressed. And finally, 30 to 50% of patients with chronic pain experience significant depression or anxiety conditions that can greatly worsen their quality of life. The third and final big picture question about pain psychology is, how do pain psychology treatments help? Based on decades of treatment research, pain psychology treatments are helpful in a variety of ways. Note here that the primary focus on pain psychology treatment isn't to reduce pain severity. Instead, the primary focus of pain psychology treatments is to increase function and improve quality of life. This focus on functional improvements often makes participation in pain psychology therapies an excellent complement to a patient's medical treatments, as medical treatments are often more focused on reductions in pain severity, with necessarily less attention to the emotional, social, and quality of life dimensions of pain. Now that we've covered the big picture of pain psychology treatments in the first few minutes, let's take a brief look at the three major mechanisms through which pain psychology treatments help patients with chronic pain. These mechanisms include changes in thinking, changes in behavior, and changes in emotions. One of the most common objections people make about participating in psychotherapies, including pain psychology therapies, is that they don't see how talking about problems will make any difference. When you think about it, these people have a point. All across the world, people, on average, spend hours per day talking about their problems. Personal life problems, work problems, political problems, and so on. there's a good chance that you yourself spend plenty of time in these discussions. Virtually never do these conversations make any practical difference. Based on this experience, it is easy to see why people would often draw the conclusion that talking about problems is a waste of time. What is different about psychotherapy is that there is a structure and purpose to the talking, with the aim of producing changes in how people think, behave, and feel. As you can see from the picture here, it is helpful to think about thinking and talking as the potential beginnings of a domino effect that gradually shapes the rest of a person's life. The current state of even your own life is the direct product of your prior thinking and talking habits. And for your own future life to improve, your thinking and talking habits will also need to improve. Here are some examples of the types of new and improved thinking promoted by pain psychology treatments. In regards to pain, better thinking promotes a higher level of personal responsibility, greater optimism about the future, and an openness to learning, as opposed to thinking patterns that promote catastrophizing, resignation, and hopelessness. Similarly, a key piece of pain psychology treatments is promoting a more collaborative role for the patient with their pain management team. The second major piece of pain psychology treatments is promoting changes in behavior. Chronic pain acts a bit like a hand grenade in that it causes harm to the person in a broad radius, well beyond the specific body areas actually experiencing the pain symptoms. A goal of pain psychology treatments is to educate patients about the vicious cycle of chronic pain shown here, and to help them to interrupt this cycle by teaching new behavioral habits that counter the effects of the chronic pain cycle. This means, for example, exercising more instead of less, sleeping better instead of worse, improving health and relationship habits instead of letting them decay, and so on. This image is another visual aid that can help patients to see and discuss the relationship between pain and their lifestyle. Think of this image as a kind of before and after advertisement that you might see in a fitness magazine, suggesting the possibility of transforming a low quality of life dominated by pain to an improved quality of life defined by values and goals. Here's another way of understanding how chronic pain becomes so harmful and how psychological factors often play a major role. Consider a common injury example such as spraining your ankle. After such an injury, a person will typically rest, take time off from activities, and perhaps even use pain medicines to help with their symptoms. Were the person to see a doctor, the doctor might even recommend precisely this response as the proper treatment, and this behavior pattern might last for days or even a week or two, depending on the severity, to promote effective healing. But now imagine that the person's symptoms didn't improve, and that months later the person was still resting, still taking time off, and still relying heavily on pain medicines. This is exactly what often happens when acute pain gradually becomes chronic pain. As acute pain becomes more and more chronic over time, not only will there have been physical harms such as physical deconditioning, but also emotional harms such as social isolation, anxiety, and depression. As time goes on with the pain, the emotional components tend to become larger and increasingly influential. Finally, as chronic pain takes root, it begins to interfere with the fundamental needs that make us human. Regardless of our superficial differences in age, gender, and ethnicity, we share desires for meaningful lives, for close social connections, to contribute in ways that make us feel valuable, for a sense of growth and achievement, to feel fundamentally safe, and to experience a reasonable degree of novelty and adventure. When you think about chronic pain, you may appreciate that it has the capacity to cut off all of these human needs, leaving behind a person who is hurting psychologically as much as physically. A critical goal of pain psychology treatments is to help the person find new ways to fulfill their basic human needs. Thank you, and I am happy to respond to questions about this presentation at this email address.